5, 4, 3, 2, 1.
Coming up next on the Jeff Crilley Show, how AI is being used to predict the spread of COVID-19. That's just ahead.
Many are predicting that the worst is yet to come, which is unfortunate, said one person here. Until now, they've enjoyed the reputation of being the nation's icebox.
Watched a burglar in his home this morning by webcam.
As a journalist of over 25 years, stories are what make my world turn.
Reporting live from the Dallas newsroom tonight, Jeff Crilley, Fox 4 News.
But in 2008, I took the jump from my familiar life and started a PR firm from my home. We're talking about anyone with a camcorder like the one I'm using becomes a television network. We started slowly growing the company, and we now have over 100 clients, and we've branched into the world of live digital broadcasting. I now own 8 different TV studios and have a huge team, and the stories that I now get to share are sometimes the most important of my life. Life has a funny way of coming around full circle. This is the Jeff Crilley Show. Well, obviously, everybody who's on the front line of healthcare is a hero right now. And one of the unsung heroes is with me in studio right now, Aida Somun. She is the Chief Operating Officer of PCCI. Thank you for coming on the show.
Thank you, Jeff, for having me.
Yeah, now that stands for Parkland Center for Clinical Innovation.
That's
and
right.
When I say unsung hero, I didn't know you guys existed.
Well, thank you, Jeff.
But you guys have been here for a while.
We've been here for a while. We were part of the Parkland Health and Hospital System, and in 2011 became our own subsidiary 5013C. And we work with Parkland very much in the community, but also other healthcare organizations.
So I said in the tease that AI is being used to help predict the spread of COVID-19. That's kind of a broad generalization, but talk to us about how PCCI helps.
PCCI, in a nutshell, we utilize big data to solve healthcare's most complex problems. And we all understand that health doesn't begin in the healthcare setting. Health is where you live, where you learn, where you pray, where you play, and it constitutes 70% of your overall health. So we're strong believers that data and utilizing data outside of just your medical record, like your social determinants of health of where you live, needs to be put in context, and a large amount of data about your health is processed to really cater to you and provide the best care possible to the individual to improve their health.
And you were telling me off camera that these last few months have been very busy for you guys because you've been working with the county to get the information out to the public. You're identifying hotspots, and then you said something about text messages. Tell me that story.
That's right. So COVID, as you know, came upon us as a big surprise. None of us could have predicted that, but once we understood that we had the ability to take the data that through the work with the Dallas County and the Parkland Health and Hospital System, we are able to hotspot or geomap where the positivity rates are the highest in our community. And with that work, issue or send teams to perform testing in those areas to prevent spread. The text messaging is an effort also with the Dallas County and Parkland for contact tracing efforts. And through text messaging platform, we're able to send text messages to all COVID positive patients and remind them or encourage them to stay safe, stay inside, and also give us information about who else they might have contacted, so those people can also be alerted in the hope to curb the further spread.
And your fine work with PCCI has been recognized. I know that you've won the Malcolm Baldrige Award, and you were just recently named by the DBJ one of the Women in Excellence, Women in Business Awards. Congratulations on that.
Thank
Well, that
you
must
so
have been
much.
quite an honor.
It is a very big honor. Honestly, I did not expect that I would be awarded, and I'm very humbled that I'm able to represent PCCI in that light, and also encourage other future women leaders in healthcare and in technology and business to one day follow that lead, and that we can mentor those students and women in business.
Well, as long as we're talking about students, I came across a great video on YouTube, and it talks about your summer internship program. Let's go ahead and roll that.
Sure.
Parkland Center for Clinical Innovation SAC Summer Scholars is one of North Texas's most prestigious internship programs. With a focus on bringing women into this industry, the internship program offers a platform that gives women a chance to learn side by side with some of the top minds in the data science and clinical world.
I am extremely proud of this class, especially because of all the differences and the challenges that we had to face with being virtual, with COVID-19.
I was very excited to really see that how much each of the interns really jumped into their project just absolutely enthusiastically.
Working at PCCI was definitely a challenge. Before this, I had only looked at data from a textbook, which is always straightforward, but real data, nothing really goes how you expect it. So it's definitely a challenge.
The analyses that I do are taken by the provider, Yolande, and she will take those results to her meeting with the other organizations, and she will discuss the results, and that really makes me feel that I'm doing something that is readily applicable and used in the real world.
It's really rewarding being able to truly make an impact here. Because I know that the code I'm writing can be used to learn more about the pandemic we're all facing and has the potential to tangibly improve lives.
I learned a lot about about the industry practices of developing code, such as logging, and also I learned about developing data visualizations, such as geomaps and the dashboards.
The most rewarding part of my internship was the experience. I got to work with real-world data and help solve real-world problems.
I compiled COVID data into different graphs and charts to be able to find trends and locate solutions for this virus.
I think this is very unique, and I'm very proud to be a part of this whole internship program.
So appreciative of the work that the students have done and the interns help us advance the ball in so many different ways, and it's been fun just like any other year.
We wish you all the best, and we hope to see some of you again next summer.
We want to give our thanks to all of those in PCCI, Parkland, NAF, and SMU for their support with this year's intern class. We especially thank the hard work and diligence the individual interns demonstrated while working on programs that made a difference in our communities.
Very cool. And you got a chance to work with many of those interns.
We did. It was just a phenomenal experience to be able to pair up our data scientists and together work on very important problems. And they actually came up with some phenomenal approaches that we did not even think of for pediatric asthma, for COVID prevention, and gave us other ways of looking at things and approaching our work.
Well, I want to brag about Aida because she works around big data, but it doesn't mean she spends her whole life behind a computer screen. She actually kind of roams the halls as almost like a health detective. Why don't you share that story with us?
So the story about the individuals, how we connect them to community services, honestly, we've had numerous programs where we helped connect individuals to food, to transportation, housing as part of the Accountable Health Communities grant. And I myself walked the halls in the Parkland Hospital to understand what the barriers are to health. And I've spoken to individuals, and what I determined working with the team is we've had the luxury to spend 20 minutes talking to individuals in healthcare setting, in the rooms, to ask them about their life and understand what really bothers them and where the barriers are. And when we came to find out that people share their vulnerabilities with you, and when you establish that connection, physicians are not always able to have the time to spend that. And through that, we understand that there are a lot of folks that need food, that need transportation, that need housing, and as part of the grant, we've connected them to those services. And they've been very grateful for that. They did not even know that those services existed in our community. But through this work, we've understood that how important it is to understand that the most vulnerable continue to be most vulnerable, whether for COVID or other adverse events that are unknown to them. We really need to provide better care for those individuals and give them care in the context that makes sense to them. Yes. So when you provide predictive models, and the work that we take a large amount of data needs to be also put in the context to the individual that you're providing that care to. So for example, if you know that the individual has diabetes and you're giving him diabetes medication, you have to understand, does he have a refrigerator to store that medication in? Or providing a prescription to take more walks every day to an individual that may live in a neighborhood that doesn't have sidewalks. So whenever we talk about care, that's why social determinants of health are so important, that it's not just a medication, it's how that individual interprets that. Are they able to do it in a context of what applies to them? And I think that's how we approach all of our work. It's not just about the data, it's really the insights that we get from individuals after speaking to them and ensuring that they follow those for their own self-improvement.
Outstanding. You have been an amazing guest. We're going to put your website up so everybody can connect with you and follow you guys on social media. It's PCCIinnovation.org. Aida, thank you. You've been an amazing guest.
Thank you for having me.
You bet.
It's a pleasure.
And that's it for now. We'll see you next time.